The lung transplant evaluation. The purpose of the evaluation process is to evaluate your candidacy for a lung transplant and educate you and your care partner about the entire process. The evaluation process includes a review of your medical and psychosocial history, diagnostic tests, blood work, and multiple consultations. You'll undergo an extensive evaluation process by a multidisciplinary team of lung transplant experts. That team includes social workers, a transplant coordinator, a pharmacist, a lung transplant surgeon, a pulmonologist, a behavioral health specialist, advanced practice providers, nurses, a nutritionist, and physical medicine and rehabilitation specialists. You will be assigned a pre-transplant coordinator who will be available for any questions or updates during the evaluation and waiting list period. After your evaluation, a committee made up of multidisciplinary experts will decide if lung transplant is the right treatment for you. Requirements. Your transplant team will provide a health maintenance checklist that details all vaccines and routine care needed prior to receiving a lung transplant. You are encouraged to complete these with your local PCP or pulmonologist as soon as possible. If you do not live within a 4-hour drive of the hospital, we will help you make arrangements to stay in Pittsburgh. For those traveling to Pittsburgh for care, both nationally and internationally, we can provide information about local housing options. We help all patients arrange a post-transplant lodging and transportation plan within a drivable distance of Pittsburgh until medically cleared to return home. We require that non-local patients identify their plan prior to listing. You must be nicotine and substance abuse free for 6 months before listing. Care partners. The UPMC transplant program requires you to identify 2 primary care partners. During the evaluation process, you must bring both care partners with you to all appointments and education sessions. One or both care partners should be available to you at all times for the months following transplant to help with meals, laundry, appointments, transportation, and other responsibilities. If care partners change at any stage of the process, please inform your transplant team. The lung transplant waiting list. An active status means you can receive offers. If you're listed as active, make sure your phone is always on and that you check in with your coordinator every 2 weeks. Your time on the waiting list varies based upon compatible blood type, sickness, height and weight, antibody status, and organ availability. While you wait for your lung transplant, again, check in with your coordinator every 2 weeks to maintain active status. You will regularly attend follow-up appointments with your transplant pulmonologist and surgeon based on your needs. You'll have access to ongoing education while awaiting transplant. Maintaining your health and staying active as much as possible by continued participation in a structured exercise program is crucial during the waiting stage of your lung transplant journey. We ask that you live within 4 hours of the hospital. We partner with Family House to provide affordable lodging to patients and their care partners who do not live in the area. Transplant surgery. Review the materials mailed to you and bring any questions to surgical clinic. When you arrive for the transplant surgery, we will run several tests to ensure you are in good health with no active illnesses. You'll receive general anesthesia and sleep through the transplant procedure. Surgery can take 6 to 12 hours, depending on anatomy, prior surgical history, and if you're receiving a single or double lung transplant. During your lung transplant surgery, your surgeon and care team will remove your diseased lung or lungs and replace them with healthy donor lungs. Your stay in the hospital after transplant will depend on several factors, such as the severity of illness prior to transplant. Life after surgery. Your care team will work with you on a tailored pulmonary rehabilitation program after transplant. Ongoing tests, appointments, and health maintenance documentation are required. If home is more than 2 hours away, you will need to stay within a drivable distance of the Pittsburgh area for 3 months or longer following discharge for frequent clinic visits, lung biopsies, and pulmonary rehabilitation until medically cleared by the transplant team to return home. Lifetime immunosuppression is required. Maintain regular communication with your post-transplant team. Thank you for your participation. Please feel free to ask members of your UPMC lung transplant team to explain anything you're unsure of and answer any questions you may have. We're here for you through each stage of your transplant journey. Learn more about the UPMC lung transplant program at upmc.com/lung transplant.